Welcome to Diagnostic Imaging's Week in Review, with continued updates on the COVID-19 pandemic. I'm Whitney Palmer, Senior Editor. This week, not only have we seen more guidance for imaging around the virus, but details are continuing to emerge about how the outbreak is affecting your workflow, your finances, and you. Even though you're comfortable using chest x-rays to identify a wide variety of lung infections, new research out of the Ohio State University Wexner Medical Center reveals you can't confidently rule out COVID-19 infection if a scan comes back normal. In fact, in a population imaged in an urgent care center, more than half of the scans conducted on patients confirmed positive for the virus came back normal. These findings are important, the researchers said, because urgent care centers are most likely to see patients with milder but still contagious forms of the disease. Lung ultrasound is still being used extensively in COVID-19 management. To help protect you and your patients, the World Federation for Ultrasound in Medicine and Biology Safety Committee outlined 5 steps you can take when scanning patients. They recommended stringent social distancing, room preparation, equipment decontamination, personal protective equipment, and the use of single-use gel packets. Alongside the sudden drop in your imaging volume due to the postponement of all elective and non-emergent services, you've also seen a significant drop in your revenue. A report published in Radiology indicates, based on anecdotal evidence seen in practices, that you could be facing up to a 70% loss in income, and that the lower imaging levels could stick around for another 3 to 4 months. But they also offered suggestions for financial assistance programs and specific measures that you can take in your practice to help bolster your bottom line. Weathering the outbreak isn't just about safeguarding your practice, though. You also need to take care of yourself. Having more free time on your hands can feel disconcerting, but experts from the University of Michigan published advice on ways for you to navigate your newfound downtime. In academic radiology, they discussed taking the time to pursue professional interests that may have been sidelined, finding ways to help others, and even developing new hobbies. And finally this week, Diagnostic Imaging spoke with Drs. Dushyant Sahani and Mahmoud Mosabasha from the University of Washington about their department's experience with COVID-19. Their department saw the first cases in the country in February, and they finally reached their peak on April 2nd. Both radiologists joined us to discuss steps that their department has taken to safeguard their practice's financial health and to prepare for working through the backlog of delayed studies. They also shared the lessons they learned. Here's what they had to say. Welcome to Diagnostic Imaging. Today, we are joined by Dr. Dushyant Sahani, Chairman and Professor of Radiology, and Dr. Mahmoud Mosabasha, Associate Professor and Medical Director of MRI, both from the University of Washington. Thank you both for being here with us today to talk about the experiences and financial impact your department has had with COVID-19.
Thank you, Whitney, for the kind introduction and the opportunity to speak to you and all the viewers who will be watching this interview.
Yeah, thank you, Whitney. We look forward to talking to your viewership.
Wonderful. Well, I feel you both have a lot of knowledge to share that will be of great interest and assistance to our readers and our audience. To jump in, if you both could tell me, how has the COVID-19 pandemic impacted the image volume that your department has seen over the last few months?
You know, COVID-19 crisis, as we all know, is a pandemic, and there are almost everyone is vulnerable to that illness. Now, because we have to institute social distancing as one of the common sense measures to reduce the spread of this contagious disease, we canceled a lot of elective procedures, including a lot of imaging that comes with the elective procedures. So we have seen a substantial drop in our outpatient imaging volume, close to 70% drop, and overall radiology volume close to 50% drop in overall radiology volume. We did see some increase in certain type of imaging like chest CTs, chest x-rays, portable imaging, a lot related to COVID-19 patient volume that we saw in the hospital and the ICU. And now other things that happened is, you know, as you can imagine, even some of the acute care patients like cardiac event, you know, stroke And trauma, all those volume also dropped because of the edict from the governor to stay at home. So that was the biggest impact. We saw a substantial drop in overall imaging volume with some increase in the ED in chest volume.
Okay. So given those image volume changes, as you said, it was varied, in the various locations within the hospital and the system. But what financial steps did your department take in order to be able to kind of ride out the outbreak with as minimal impact as possible, considering that the revenue wasn't there from the imaging volume?
Well, we've taken a kind of varied approach, and we have proposed a lot of things to consider within our department in terms of ways to mitigate the loss. And these are things that we are considering currently, and we're posing to our faculty in order to have a consensus decision in terms of how to save money and reduce the impact. First step was we decided to defer our incentive payments in terms of the biannual incentive that the faculty get, and we're considering deferring 75% of the incentive payment to a later date. We're in the process, and we've been in the process of consolidating our support staff, and we've accelerated that process, and it's something that we're actively doing currently in order to mitigate some of those costs. In addition, we are looking at consolidating our call schedules and eliminating supplemental pay for extra shifts. So, and we've had this discussion with our faculty, and we're putting forth a plan in regards to how to accomplish that. So basically, in this time of lower volume, people are going to cover, in addition to the main hospitals they cover on call, cover other hospitals that we typically cover with extra pay shifts. And we're just trying to come up with creative ways in order to reduce our costs in the short term, while really focusing on the big picture in the long term to increase our revenues in order to really overcome these issues and maybe strengthen our position in the future to manage pandemics.
All right.
And I must just add, there is, our priority in this process is to ensure that faculty salaries and the overall academic mission is preserved. And to do that, most of our faculty has been very supportive, because this is not something we opted in or we could have opted out of the pandemic. So this is the crisis, and we are not unique. The entire country, and we can say the world, is going through this crisis. So I think we have a good support from our faculty and other staff to tide this crisis, and also to support these common sense types of measures.
So given that these are the measures that you chose, is there an idea of how effective they might be? And any reasoning behind them that was used to choose these as the avenues that you wanted to pursue in order to protect the financial security of the department and your radiologists?
Whitney, we wanted to be very pragmatic and making sure that this is a collective effort, and there will be some compromises made by everyone, or starting from the top. And we all will have to make contribution through extra shifts or working a little bit harder over time, including during summertime. We collectively agreed to reduce number of vacations we will take if the exam volume is high, because our primary focus is making sure patient care and our academic mission is preserved. So, and you learn through any approaches that you apply that, you learn over time. You might have to change your direction a little bit. So overall, if there is a buy-in from your staff and faculty, then you are more likely to succeed. And as Dr. Moshe Basha mentioned, one is the cost cutting measures, which is common sense, but also one needs to keep an eye on a longer term vision, because healthcare function not on cynicism, but on optimism, on purpose. So you want to make sure people feel motivated and they have the purpose to come out of this crisis faster. So if we have to change our strategy over time, let's say 9 months from now, we might. Yeah, we are prepared for that.
If
And I,
that,
I
I'm sorry.
just, and I do want to mention, these are a lot of steps that we had planned on initially, you know, especially a lot of the growth options. But in addition, some of the cost cutting options are things that we've been considering for a while. This crisis just accelerated our timeline in terms of accomplishing these things.
All right. You mentioned that, if this were to last for several more months, that you're prepared to take other steps. Are there things that have been discussed, or is that a situation where you will kind of cross that bridge when you come to it and assess what needs to be done during that time frame?
Well, we have laid out a plan in terms of things that we could do and steps that we could take that range from relatively small reductions in the short term to things that may be slightly more prominent. And so one thing that we were proposed is a hiring freeze for 6 months. Now, if this continues to extend and the financial impact is larger than we had expected, that's certainly something that we could extend further. I think just identifying inefficiencies and removing inefficiencies is another thing that we're working on in terms of streamlining our imaging and making our imaging more efficient and increasing our volumes through that process. And that's more of a growth aspect, but in addition, it's something that can certainly help in terms of reversing the impact going forward. You know, shutting down inefficient research cost centers are things that we're working on. Just really identifying those inefficiencies, resolving them, and having options in terms of kind of rolling assessments for some of the steps that we're taking.
And I must just add is, the COVID crisis has disrupted the healthcare. And this is also an opportunity to do things more efficiently. Healthcare is one of the most expensive, industries. And due to a lot of redundancies in the system, the regulations and all, and I think we haven't embraced technology as well. And one great example of how technology is enabling better access and lowering cost is through the growth in telehealth. So some of the solution that we have deployed during the crisis, we might see how that can be applied in the future practice to gain the efficiencies in our system that will lower the cost but also improve our productivity.
All right. Well, then turning to what comes next, then, there will be a time when we finally come out of this situation and everything seems to be under control. At that point, no doubt you will be faced with a large influx of imaging that has been postponed. What strategies do you have in place to work through all of those patients in the studies that need to be taken care of as efficiently as possible?
So that's a great question, and there are still some unknowns, Whitney, in terms of how long the virus will stay in the community, and we might have to still follow the social distancing norms for next few months, and that puts some challenges in terms of how much we can ramp up our imaging operations from day one. So we will take a more of a scalable model gradually over time, making sure we still protect our workforce as well as patients who might not be infected. And then gradually build it, and making sure that we are able to handle those volumes. This will require a teamwork, and we are creating those teams. It will require amazing communication, both with referring physician as well as with patients. We are also planning to extend hours of operations of our high value imaging equipments, including making weekends as a regular schedule if need be. Looking at some other measures to streamline our workflow like MR, which takes a lot of time if we can make more shorter protocols. We are looking at technology solutions to allow us to do better, smarter scheduling or a cluster scheduling. And being thoughtful about how we deploy our workforce. It's critical that we can only come out of this crisis with the support from our workforce. We are fortunate. We have amazing, talented pool across right from the front line to leadership positions, and the trainees, everyone is involved. So making sure people are engaged in this process and we protect them and allowing some of them to also read remotely from home, the solution we have put in place right now, making sure that we are not really stretching our most valued resource, our people, while trying to recover from this crisis.
And we have created some reserve within our workforce, both between faculty and staff, including technologists and nursing, where we've given them during this crisis, because of the reduced volumes, the option of taking their paid time off now, whether it's because their kids are home and they need to be home with their kids for childcare, or if there's concerns about vulnerabilities for poor outcomes in COVID-19 infection or general anxiety about infection. We offer them the option of taking their paid time off now, so that we'll have an increased access to the workforce once that post-COVID surge occurs. And in addition, we've really looked at maximizing the efficiency, kind of building on what Dr. Sahani said, maximizing the efficiency of our scheduling as well, in addition to maximizing the workflow efficiencies of the imaging modalities, but also utilization of our outpatient imaging centers, and really creating a dynamic scheduling process where patients can get scheduled between sites much more efficiently. And so those are kind of steps we're taking as well to really improve our ability to handle the increased requests and increased volume, as well as being able to schedule it and manage it once it comes.
Well, thinking about patients, it's been several months and a lot of patients are probably not thinking about the imaging that they need. Are there steps that you have in mind or in place to re-engage these individuals, to bring them back in, to make sure that they do take advantages of the services that you provide?
So in terms of the postponement of scheduling, one thing that we've done that I think is really appreciated by patients is we leave it in the hands of the patients and their ordering physicians in terms of rescheduling. So for patients that feel that their imaging is really critical and really time sensitive based on their symptoms or based on the underlying disease, they are afforded the opportunity to reschedule as they see fit, or postpone as they see fit, I should say. We send them automated text messaging that communicates, the urge to reschedule based on the COVID-19 pandemic and the risk of infection. And we communicate to them that they should contact their ordering physician in order to reschedule. And we provide them the rescheduling line. If a patient feels, I need to get my imaging because my symptoms are so severe, they have the option of doing that. And then patients that end up postponing their imaging go into a queue. We don't immediately reschedule them, or we haven't thus far, because we don't know when this pandemic is really going to subside and when we'll be able to open up the imaging environment again. So they go into a queue because we wouldn't want to reschedule them, say, for May 4th, May 5th, May 10th, and then, a week later tell them we're postponing that appointment again as well. We want to ease the communication and the anxiety and the stress on our patients, while also providing them the optimal care and the diagnostic imaging that they really need. So as of right now, they're in a postponement queue, and hopefully once we get to the point where we know what our target date is, we will begin actively rescheduling them.
All right. Well, then finally, as Washington was the first state to see the emergence of COVID-19, you're slightly ahead of the rest of the nation in dealing with this, reaching your peak, I believe, on April 2nd. So what lessons have you learned that you can provide to other radiologists as they continue to weather this storm?
I think, Whitney, there were many lessons. And the first thing, we have to take this disease seriously. And we need to really put the measures for social distancing well in place. And this requires effective communication and also leadership that leads by example. you need to put a good team in advance, and to make sure there is people have roles and responsibilities. There is a common channel for communication, having more engagement from different groups, making sure you protect your frontline staff as much as possible, because they are your valuable resource. If they get infected by COVID, then it creates more challenges. So measures like providing them with PPE and all that is critical. Engaging the referring physician and patients as you defer certain exams or elective procedure for a later date, or screening types of studies which are non-critical. Engagement there is communication with your staff on a regular basis. Very informal sometimes is more effective, like a town hall style meetings, and having and minimizing number of emails you want to send out to people, because there is so much news about COVID. There is like anxiety, there is fear about COVID. You want to make sure you are transparent. You share the data, but without creating fear. Keeping them engaged and being very optimistic about the purpose and mission and the passion we have for patient care. So these are, and for the measures for reducing your impact on the radiology finances, doing the common sense measures with Dr. Moshe Basha mentioned, but also keeping an eye on the future volume and growth and other things. So and the testing, actually, one thing I forgot was the testing of all the things has been one of the most impactful after social distancing and hand hygiene was the testing. Washington was one of the first states that ramped up testing from able to do few hundred patient or samples processing to now we can do more than 5,000 samples in a day. The lab is running 24/7, and I think that made a tremendous difference. Where especially for testing the workforce, if they are infected, that sends more panic among rest of the staff. So preserving the workforce, keeping them motivated, keeping them engaged is critical, especially for a healthcare side.
Yeah, and I would just add a little bit to that in terms of from an operational perspective, and in my operational role, I think one important thing to keep in mind is being prepared before you need to be prepared, and that's I think a very important point, and I think it's something that University of Washington and University of Washington hospitals do really well. I think because you think of Harborview, and it's a trauma center and a disaster center for 5 states. It's something that we're used to thinking about and used to dealing with. And I think that is one of the issues that a lot of the hospitals across the country have had difficulties, in regards to having sufficient personal protective equipment, having ventilators, having beds to accommodate patients. And in radiology, our role is having adequate and sufficient imaging capacity to manage the crisis as it happens. Having portable X-ray equipment, having portable CT equipment that can really provide the imaging access that's needed for these patients where they need it. And so I think that's something very important for hospitals to consider. In addition, as Dr. Sahani mentioned, positioning your hospital in a position where you're financially viable enough to where if a financial hit happens, you can continue operating as normal and remain solvent without having to be concerned about furloughing, or furloughing employees or cutting salaries.
Yeah, and one more point that we didn't touch on was how in an academic departments, you have other responsibilities of research and education. And we were quite thoughtful, and we had amazing leadership on both these sides, on the research and education, is how to preserve it. So we use technology extensively to teach, train our residents, even, doing case conferences. Dr. Moshe Basha and I have organized now virtual grand rounds once a week where we bring in expert faculty from the country, from different major academic institution to give us grand rounds on a regular basis. So what you do is you create some sense of normalcy. Otherwise, panic and fear can bring you down. So it's critical. Same holds true for research. We defer clinical trials, but there is opportunity to start new research like related to COVID, or data science related research, which doesn't require patient contact. So the whole engagement of your workforce is critical, where people find mission and purpose.
Well, Dr. Sahani and Dr. Mosabasha, thank you so much for taking the time with us today and providing your expert insight and your experiences and lessons learned for those who are still going through this and will not see the end for a month or more than likely. I appreciate you both taking the time.
Thank you,
Thank
Whitney.
you, Whitney. I will tell you, everyone who are in this, we have seen flattening of curve. We were not that optimistic a few weeks back, but having been on the other side now, we tell everyone, hang in there, follow all the common sense things, and you will be out of this as well.
Wonderful.
Thank you.
It's a great positive message. Thank you both
Yeah.
so much.
Thank you, Whitney.
Thank you.